Okay, Britta, Emily, we are good to go.
Awesome. Thanks so much. Hi, everybody. Uh, Welcome to Why Policy, Why Now, Using Your Voice to Bring Change. My name is Britta Babel. I'm the Senior Research Manager for the American Cancer Society Cancer Action Network here in Minnesota. Here with my colleague, Emily, who will introduce herself and tell you a little bit more about what we have in store for you this morning or afternoon today.
Wherever you're joining us from. Hi, everyone. It's good to be here with all of you. Thank you to ACAF for inviting us to present today to talk about public policy and how our voices and experiences can inform change. I'm Emily Myatt. I'm the Regional Government Relations Director for the American Cancer Society Cancer Action Network. That's a really fancy way of saying I'm a lobbyist. I lobby at the Minnesota State Capitol, do some work in Washington, D.C., and then in some other states to advance policies that put patients, survivors, cancer prevention front and center with decision makers. I'll also add that I'm a 14-year cancer survivor. All right, so today's session is really focused on, like this agenda says, why policy and why now? So we want folks to understand what advocacy is, what we mean when we talk about advocacy and what it means to be a patient advocate, to better understand or be able to articulate at a very high level how a bill becomes a law. A little schoolhouse rock is going to happen today. And then we want you all to gain the skills and the confidence to connect with lawmakers and other decision makers to harness the power of your voice, your experience, your patients' voices and experiences to push forward and make change. Next slide. Who we are. So I first wanted to talk about who the American Cancer Society Cancer Action Network is. You will hear Britta and I say ACS CAN for short throughout the rest of the presentation. And in legalese, ACS CAN is the nonprofit, nonpartisan advocacy affiliate of the American Cancer Society. And our power, how we show up, how we do this work, our part of the mission is empowering volunteers, patients, survivors, providers, caregivers to share their experiences. Volunteers are the voice of our organization. We engage volunteers all across the country to make sure that their voices are heard by policymakers at every single level of government, from city halls to state capitol buildings, including capitol buildings in Guam and Puerto Rico, in the White House, at US Congress, and also at the Supreme Court. So we stand with volunteers, our people, to demand change of decision makers. We convene researchers, right? We bring together leaders from patient advocacy groups, business leaders, public officials to have conversations about what cancer looks like in our country, what cancer looks like in specific communities, and what evidence-based change is needed to change the landscape of cancer as we know it. We want to end cancer as we know it for everyone. We also have a judicial advocacy initiative. We have sued the tobacco industry. We have sued the FDA, right? We kind of take pride in that, I think. And we've also submitted amicus briefs or friend of the court briefs on important decisions around the Affordable Care Act, around access to care, around preventive health and coverage. And then, of course, partnerships. So much of our time, Britta and I's time, and my colleagues' time all across the country is spent with partners and building coalitions with partners like ACAF to influence legislative and regulatory solutions for the folks that we all represent. Next slide. So, of course, we want to thank our partners at the American Indian Cancer Foundation for having us today. This is a partnership that Britta and I and our colleagues at ACS CAN really value. And I want to talk a little bit about experience about how ACAF and ACS CAN have worked together. So in 2019, in the spring of 2019, ACAF came to me and flagged an issue that was happening. The Screener Circle program, which is a nationally funded breast and cervical cancer early detection program, the women diagnosed with breast or cervical cancer through that program weren't automatically eligible for Medicaid for their treatment if they qualified. And that was federal law. Federal law says that if you are screened through this program, you should be eligible for Medicaid for your treatment and coverage, right? But the way Minnesota adopted that federal statute was super narrow. And because ACAF flagged this as a problem, we were able to work and make this our legislative priority in 2020. So ACAF and ACS CAN worked together on our Screener Circle bill to make sure that women diagnosed with cancer through the Screener Circle program really focused on urban American Indian women were eligible for Medicaid and could get the treatment they need. Because we all struggle with this, right? Like, what good is prevention and early detection if you can't access treatment, or it opens up a whole can of medical debt and financial toxicity? And so just wanted to shout out this partnership there. Our bill author was then Representative Mary Kunesh, now Senator Kunesh, an Indigenous woman. And it was such a beautiful opportunity to talk about what cervical cancer looks like in the American Indian community, what breast cancer looks like. And when we think about today and Turquoise Tuesday, this is a really good Thursday. This is a really good grounding moment in that. All right, Brett, I'll turn it over to you.
I will say Turquoise Tuesday does have a similar good ring to it. So something to consider.
Alliteration.
But so just to like a level set, obviously this is a part of the ACAF's Turquoise Thursday series. And so we're going to kind of reference a lot of the work around cervical cancer as kind of like our pretend bill going forward through this presentation and training. But we just wanted to kind of level set on the importance of it. We know that American Indian and Alaska Native women are 1.5 times as likely to develop cervical cancer compared to a white woman in particular. And we know it's so preventable. We know that Pap smears and early detection is essential, and it's curable if found early. And so make sure to check out Turquoise Thursdays, the webpage on the ACAF website for all of the resources. There's a bunch of social media materials. I have my own little like turquoise earrings on today in support. But we are gonna just kind of have a pretend bill around increasing access to cervical cancer screenings going forward here today. So what does cervical cancer screenings kind of look like in its current landscape? So like Emily was talking about, we have this big federal program at the Center for Disease Control for the National Breast Cervical Cancer Early Detection Program. And here in Minnesota, we have the SAGE screening program through the Department of Health, which helps screen uninsured and underinsured folks for a variety of different cancers, including cervical cancer. All states, no matter where you are, have a comparable screening program that's funded through that big mother program at the federal level. It looks a little bit different. Some of the eligibility details might be slightly different depending on the state you live in, but for the most part, they're very comparable. But what we're going to talk about really is the advocacy that's so important to making sure that that kind of screening is accessible and available to the folks who need it. So just baseline, like what is advocacy? So it's trying to influence those to make policies, for us at least, advocacy is trying to influence those who make policies that affect our lives and the lives of cancer patients across the United States and in Minnesota in particular. And it's really one of the most important things that nonprofit organizations can do. We're able to bring these problems and solutions to lawmakers that they might not know about or might not have like a very deep understanding of. But we come forward with an evidence-based solution and help represent people who might not have like the avenues to be able to carve out their own space when we look at how big the political space and how government works. Like not everybody feels like they have that natural avenue to make their voice heard. And so advocacy helps kind of makes that space for them and builds that path. You can also advocate against something, right? Sometimes there might be a really awful bill that is up for debate that we know would have like great harm to communities. So we'll advocate against that. But we also all advocate in one way or another in our own lives on probably a daily basis. And so it's just a matter of like learning how to flex those muscles. We always joke like, if you're going out to eat with your spouse or one of your siblings or friends and you want pizza, like you're going to advocate to like get the group to go have pizza and not get burgers, whatever that might be. But we're going to kind of take that same muscle today and learn to flex it in a different way to help make impact around for cancer patients in particular. There's a tons of different ways that people can flex this advocacy muscle, and it looks so many different ways. And there are very like baseline ground levels ways of using your voice and taking action and being a part of advocacy work. And there's like much higher, bigger, maybe slightly more scarier ways to take action too and make your voice heard. On this slide in particular, these are all valid and impactful ways that somebody can make their voice heard. But we have like using social media to highlight issues and tagging our lawmakers in something. We have testifying, which that might be one of those bigger, scarier ones for folks who don't feel like that's something that they can do. But I promise if in a room seeing you all, I'd be looking in your eyes. You're all capable of able to do that. You can have meetings with lawmakers. We have a group with one of our members of Congress down in the bottom left-hand corner. We have folks dropping off flyers about issues in their community. We have some day at the Capitol and rallies. We have signing our petitions. We have doing letters to the editor. What advocacy looks like is far and wide. And no matter what your professional experience is, what your lived experience is, you are able to do it, no matter what that looks like. But you might be thinking like, okay, great, like that's all fine and dandy. But what are the things that sometimes prevent us from taking action? What are the things that kind of prevent us from doing the thing? So a lot of times that just might be like a lack of comfort or understanding with like how a bill becomes a law, or just what the process looks like. You might not feel like you have like the tools and know where to start. You might not know where to get help to like find out something as simple as who your lawmaker is. You might just not know where to get that information. But I think the biggest roadblock that a lot of people face is that we don't feel like we're expert enough to be an advocate. You're gonna hear again and again from both Emily and I that like you don't have to be a policy expert to be a part of advocacy. You don't have to be a policy expert to use your voice, because a lot of times it's that lived experience that can help illustrate and highlight an issue in a way that being an expert can't convey that same exact thing. So even though you might not be somebody who feels like you have that in your back pocket of being an advocate and being able to talk something through from A to Z, just being able to know your own personal ABCs on an issue is big enough and makes such a big impact. And I'm going to toss it over to Emily to talk a little bit more about just why the policy piece is so important.
So why policy? Like Britta said, I think policy comes from I can create this reaction to people of like partisanship, contention, disagreement, and really strong emotions. And we try to separate out policy from politics, right? Like I like the political thing. That's why I do the nerdy work that I do. But I love public policy even more. And Britta said it, it's impact, right? Many important decisions about cancer, cancer care, cancer prevention aren't made in our doctor's offices, aren't made in your offices, aren't made in the clinics that you are at. But instead, it's happening at state legislatures, with county boards, in Congress, the White House, the Supreme Court. And it's so important that the impact of these decisions are known by every single one of us, right? By patients, by caregivers. I think this, and I see this because I'm at the Capitol every day, but policy impacts every single aspect of our lives, right? We know that, we experience that, we live that. And so I think making sure that no policy is made without the perspective, the science, the experiences of the folks that we all serve, that the voices and experiences of American Indians that are diagnosed with cervical cancer or having hardships getting screened for cervical cancer are heard by members who have the decisions to make things better, right? We all know the value of direct patient services. The indirect policy change is such an important piece too. They go hand in hand together to have that population-wide impact along with that individual impact. So let's do a little bit of government relations, state government, federal government. You're going to hear me say, I love policy. I love this. I could talk about this all day. So Britta's going to keep me honest on timing and be like, okay, too much detail. We got to keep moving. Not everybody loves this issue as much as you do. But really, like we said, we want you to feel comfortable knowing the process and being able to articulate the process and see how you fit in every single step. So broadly, there are 3 branches of government. There's the executive, which looks like the White House or a governor. There's the judicial, which makes up all different kinds of courts. And then there's the legislative branch, right? And those are members who are elected to represent the individuals that they serve to make decisions. So the many layers of government, it's that same basic structure. The legislature makes the laws. The legislature allocates the money, the government money. The executive branch executes and enforces the laws. And then the judicial interprets the laws. So we're going to focus on the legislative branch today, even though ACS can and our partners do lots of work with executive and judicial. let's talk about how to find out who represents you. So at the federal level, everybody has members of Congress unless you live in DC, and that's a whole nother, I know that's a taxation without representation, but we're going to just broadly talk about what it looks like. So Congress are the folks that go to Washington, DC to make laws at the Capitol. Congress is a broad term for that legislative branch, and Congress includes the 2 US senators and 1 US representative that every single person has in our 50 states. US senator is flat. Every state has 2 US senators. Representatives in each state, the number of US representatives looks different, and that's because it's based off of the population size. For example, smaller states like Vermont and Delaware only have 1 US representative, while California has more than 50. In Minnesota, we have 8 US representatives. So it's based off of what your state population looks like. How to find your member of Congress? You can go to congress.gov/member/find your member. Otherwise, I love a Google search. Who represents me? Every state will have a page that it'll take you to look up who your federal members are. But this is something, if you haven't done it, I would encourage you to do so, especially we're coming up with an election season. So it's a good time to know who your members are. Then we have representation at the state level as well, right? So I'm going to use Minnesota as the example, but every state has some sort of model when it comes to representation at your state legislature. Minnesota has 201 legislators, 67 senators. So there are 67 districts Minnesota is divided into. And of those 67 senators, there's 134 representatives. So for every Senate district, there's 2 House districts or 2 representatives. So 2 House districts in every Senate district. But again, it looks a little bit different in every state. Some states are unicameral, so they only have 1 legislature. So not senators, not representatives, but members. New Jersey and Wisconsin have assembly members instead of representatives. So the name might look different. The structure might look different, but everybody does have representation in their legislature. In Minnesota, when I Google who represents me in Minnesota, Britta, you can go to the next slide. This is what pops up, and I'll type in my address, and it actually does pull up my federal members too. So if you don't know, Google who represents me Washington legislature, who represents me New Mexico legislature, and that's a way to find out. All right, I'm going to keep us moving forward, and let's do a little bit of schoolhouse rock. Talk about how a bill becomes a law. Now, this chart is wacky, right? I know that it's like there's arrows going in different ways. Things are tying back. There's movement back and forth. It looks a little bit different from the I'm just a bill that you might remember from school or the political process that you hear about when you're listening to the radio or watching the news or reading an article online. So this is broadly what the process looks when it's mapped out. I'm going to give you a very stripped down version of the process so you can understand at a bare minimum what the process looks like generally. And so you can better understand kind of the points or moments that you can be influential, you could be an advocate in this process. So let's start out with our bill. Our bill that we're going to walk through this path or this system is around that SAGE screening program that Britta and I have talked about. So again, Minnesota specific, but could be applied to other states. And here's a little teaser for future webinars that talk about state policy happening across the country. So our bill is going to increase funding for the SAGE screening program in Minnesota to make sure more women can access cervical cancer screenings. So this idea. We've worked with our partners. We know that this is an issue and we want to do something about it. So where do we begin? We have this idea. So it all starts with an idea. We know it's a problem. We love science and evidence-based solutions. So we're going to bring one to the legislature. Now, I, as Emily Myatt, cannot write a bill and drop it and get it introduced. I can certainly go to lawmakers with recommended language and say, hey, as the American Cancer Society Cancer Action Network, or as the American Indian Cancer Foundation, here's what we're seeing, and here's some language recommendations we have. And so I will take an idea, or a partner will take an idea, or we'll bring a volunteer with us to talk about the experience, and we'll say, lawmaker X, we really want your support on this issue. And so sometimes as a lobbyist, I'll have an idea in mind on who I think would be a good bill author because maybe they have a cancer experience, or maybe they're an American Indian, and that feels really right for a bill that represents a specific American Indian population education around cervical cancer. So you go to bill authors and you say, hey, would you consider carrying this? Would you champion this for us at the Capitol? And hopefully most of the time they say yes. So then you work with the bill author, or a lobbyist works with the bill author, or an organization works with the bill author to get the language drafted. And then that bill author drops it for bill introduction. And so there will be a bill in Minnesota in the House and in the Senate. You want to pass the same language, right? And so you drop the bill on the floor in the House and in the Senate. Dropping is our slang way of saying introduced. So a bill has been introduced. From there, that bill needs to go to specific groups of bodies called a committee that has jurisdiction over an issue. So for a bill that talks about funding for a cervical cancer screening program, that would probably have to go to a health committee, right? That's a committee of lawmakers, a small group of lawmakers that talks about all things healthcare. It would probably have to go to some sort of finance or appropriations committee, because remember, the legislature spends the money of the government. So a bill goes through the committee process. There's something called a bill hearing. That's when maybe 10 to 15 lawmakers from both sides of an aisle, Democrats, Republicans, independents, come together. They hear a bill. They hear from the bill author about what the bill does. They hear from nonpartisan research staff that talks about, here's why this bill is needed. Here's how it fits into state statute. And then they hear from advocates. They hear from lobbyists, from proponents, from opponents. And the most important part of a committee hearing, from my perspective and from Bretta's perspective, is that patient voices are heard. Provider voices are heard. This is a chance to come forward and share those real life experiences that are way more impactful than statistics. So a bill passes out of committee. That's always what we want, right? Or if you don't like a bill, it gets killed in committee, and it passes. And then from committee, it goes to the full floor. So it has to go to the full House floor and the full Senate floor. And it has to pass from the floor, from the legislature, the entire legislative body, before it can move. Now, sometimes a bill might look a little different. Maybe the House made one change, even a one-word change, and the Senate didn't. Then they have to come together as a joint conference committee. So it's senators and House members coming together, a small number of them, to work through the differences and put together a final joint agreement. Because they can't send two separate bills to the governor's office. That would get really messy. And honestly, it sounds like it makes me nervous just thinking about it. So from a conference committee, they have a shared agreement. It goes back to the House floor, back to the Senate floor. They pass an identical bill, and then eventually it goes to the executive or the governor. So I know that is a lot of steps. The good news is there's people like me, there's partners like ACAF who track this work, who are paid to do this work, who love to do this work, and we can help you throughout the process. You are not expected to know this process, but it's helpful to see that every single moment there's a chance for you to talk to bill authors, to talk to your House member, even if they don't sit on a committee, to talk to the governor and lend your voice and influence this process. So let's talk a little bit more about what does influence a lawmaker. So here are some considerations that lawmakers do think about when it comes time to taking action on a bill, taking a position, authoring a bill. And I will say that all of them do have an impact on members, or like they all think about these things, right? How large is the problem? Is there a real solution? Does it impact the folks in my district? What's the cost? What are organizations like ACAF saying? What are the community clinics in my district saying? What are constituents saying? Is the media chiming in on this one? Does it impact me personally? Britta and I always really like to know when a lawmaker has a cancer connection, because that's that natural piece. Because honestly, at the end of the day, politics is all about connection and building those meaningful relationships on an issue and beyond. And then what does my constituent say? And will it help me get reelected? And how does this impact my fundraising? So all of these things do influence lawmakers. Britta and I and others at the American Cancer Society Cancer Action Network have gone through an organizer training from the Midwest Academy. So it's called Direct Action Organizing. And the Midwest Academy has been around for decades. They have done political organizing on the labor movement, on the women's rights movement, on the civil rights movement. And the method is all about giving organizers, people, ordinary people, people who care about an issue, the tools to turn their passion into action, and to make those actions something that builds our political power and results in progressive change, very honestly. So the Midwest Academy talks about building willpower and shifting political power on campaigns. And so for the Midwest Academy, we are talking about political power. And so from that model, political power is two things. It's money and it's votes, right? We think about, how will this impact my district? Will it get me reelected? Does this impact my fundraising? These are all things that lawmakers have in mind, because most lawmakers, and I will say this, despite what we hear in the news, most folks show up every day for the right reasons, right? Even if we disagree on how we do it, it's generally for the right reasons. And so it's what do my people say? So at ACS CAN, we don't have money, right? Like, we don't give money to candidates. We don't endorse candidates. We don't have a super PAC because we really want to be seen as nonpartisan. And we don't have money of those who might be against us when we think about the large lobbying interests, like, for example, big tobacco when it comes to our commercial tobacco policy work. We don't have that money. But what we do have is votes, AKA our constituency people power. And so our work is always about using our power, which is people, which is stories, which is experiences, which translates to votes, to express and influence an issue. And then the one thing I do want to kind of really end with here is that it's not enough to be right or to have the truth on our side. Think about all of the times that you've advocated for something at your clinic, with your family, or you believe in an issue and it's not going that way. We all know it's not enough to be right or have the truth on our side. It's all about organizing and finding our shared political power together and leveraging it.
Oh, I lost my mute button there for a second. So like Emily was saying, what we do have in this work when it comes to like the public health people power that we have, knowing that we're not going to get those cauldrons of money to be able to kind of buy people to our side. But what we do have is we have people who care about these issues, and we have people who we know want to make their voices heard. And so we know, like Emily said, it's not enough for us to be right. But we know that we can help reduce cervical cancer, right? Our pretend bill to make sure that we get more funding for cervical cancer, we know that that will help save lives. And we know that it is absolutely essential to make sure that more women, cervical cancer is caught earlier, better chances of survival, easier treatment. We know that is true, but it's not enough to be right. And so, like Emily was talking about with our direct action organizing, we really lean into the people power that we do have. And this graphic, it's kind of silly, but it proves our point that like ACS CAN alone, we're not that big of a fish. We can't chase the big guys solo, but what we do have is we have a massive activist base in Minnesota who care about this issue. We have incredible partners like ACAF and others who also have that people power, that people care about. And even though you might be hearing what Emily's saying about how a bill becomes a law and maybe you got lost in like the political process and how it all works, that doesn't matter. Because as long as you're one of those little fishes and that you feel connected to the issue and you are willing to share your story, make your voice heard in whatever way, you're helping us become that bigger, stronger fish to really like catch up to those bigger ones and help again to solve those problems, reduce the cancer burden in our communities and help find solutions. And so how do you be that little fish, right? Like what is your power in there? And your power, as I know it sounds cliche, and this is an exceptionally boiled down version of this, your power is in your story. Your power is in why you care. Whether it's around something that has to do with something that is instrumental to the clinic that you work at, and you see this reoccurring issue with maybe something in access to care, or maybe you keep hearing about people who just can't afford food or housing. Whatever your connection to that issue is, that's your story. And that's what's really going to help you move an issue forward. That's going to help you be a part of that bigger group of people fighting against these really massive problems. And so your story has a couple different components. And again, it's very boiled down, but these are always the things that whatever your pitch might be, so however you're using your voice, whether you're in a lawmaker meeting or you're writing a letter to the editor, or you're just having a one-on-one conversation, trying to talk to somebody about it. And again, this doesn't mean that you have to be that person who is at the top of the list with this idea, bringing it to a lawmaker to have this bill. You might just be aware of the problem and how it impacts you and want to be a part of the solution, not necessarily the solution, but a part of it. So your pitch, your story has a couple really important pieces. So the first would be, who you are, your name, the title, where you work. Especially if you're talking to a lawmaker, they're going to want to know if you're a constituent, because what are you to a lawmaker who you're a constituent of? You're a vote. They want to make sure, they want to work to get your vote next time you vote for, they're up for re-election. Where you are from, obviously, is tied to that as well. Because maybe you work at a clinic in their district, but you live somewhere else. What you want, like, what's the problem that you're here talking about? You know, you want to make sure that when you're talking about this to whoever your audience might be, that like you're getting the point across, right? That you're getting to the point, you're making it clear what either the problem is, you're making clear what you think the solution might be, and then you're sharing why it's important. That could be like a lived personal experience of like, I'm a cervical cancer survivor, or you might have lost your grandparent to cervical cancer, or you might have like seen a loved one benefit from early detection broadly for whatever their cancer diagnosis may be. Maybe you see it in your clinic, what a late stage cervical cancer prognosis looks like, and you're sick of seeing that because you know there are solutions. And so it can be that really deep personal connection about why it's important, but it also can be that like bigger picture, large scale, maybe slightly further away from the problem, but you still want to see that solution come through. And then, especially when you're talking to a lawmaker or a decision maker, or really anybody who has that big like legislative power, you want to make sure you like make the ask. You want to make sure that they'll support the thing or oppose the thing. Because then, as wonderful as that conversation could be, as you're talking to the person, if you don't kind of get them to commit and you don't get them to like kind of join your side, and maybe you just want somebody to be neutral. Sometimes you're just asking for somebody to keep their mouth closed on the issue. But no matter what that ask is, if you don't get there and make that ask, you kind of like bared your whole soul without getting what you really need to help get that bill to the end goal. And again, we have a little like algorithm, a little formula that we use. This is especially helpful for like one-on-one lawmaker meetings. And again, it's so boiled down. Obviously, if you're talking to a lawmaker or talking to somebody just about the problem, there's going to be back and forth. It's going to be a natural conversation. But kind of, it's a good, helpful formula where if you have 10 minutes to prepare for talking to somebody about the issue that you're seeing, it kind of helps you get your thoughts in place, put it all together in a way that makes talking about the issue and being a part of this solution, being part of the movement, a little bit easier. And so we call it our hook, line, and sinker. If any fishermen or women or people are on the line, maybe you'll get a kick out of this. But so the hook, again, that's those introductions. It's the name, it's where you live, it's what you do. If you're somebody who like has that, like, we call it a grass tops perspective. So that might be somebody who's a little bit more, maybe you're a physician or you work in the medical field actively with patients all the time. Maybe you're in a leadership role at a community organization that works broadly with Native, for the Native community, or again, maybe you are a large donor to a political party. Just even being able to like name drop that information about you is really, really helpful. For many of you on the line, sharing what tribal nation you're a part of, that could be a really good and valuable perspective that you bring that not a lot of other people are able to also include. And then your line. So you have the hook, you got your hook out there floating. The fish, the lawmakers kind of swimming about, checking it out. But the line is really where you kind of make, you really make them want to be a part of it. You make them listen. You share it in a way that they're going to want to hear. And so this is where you'd share that personal story or those talking points that you might have. Again, the personal story could be from your own literal lived experience, or it could be that of what you see in your community broadly, what you see at the clinic you work in, what the community you serve at your organization, what they're always coming for. And that can be anywhere from like a really brief couple sentences to a couple minutes long. But in the example that we're going to go through here in a hot minute, it's a very condensed short version because this can be really helpful for those really quick interactions, almost like an elevator pitch, or it can be something that can be really expanded along. So we got our hook out there. Our line is out there. We've shared why this matters. We shared why we need them to get on our side. We shared why it's so important to support evidence-based policy. And then the sinker, that is where we make the ask. Again, we ask for their support to increase funding for cervical cancer screenings in our state. We ask them to oppose a bill to cut this really important funding. We ask for them to maybe not vote no in the committee hearing if we think they might vote no. We ask them to go use the restroom, step out in the hallway when this bill comes up to a vote. Whatever that ask is, whatever you need to get from them, that's where you kind of put that sinker. And I think this is really helpful too, even if you're talking about the problem to somebody. Almost like if when ACAF first approached Emily about the Screen Our Circle issue here in Minnesota, they kind of had to hook Emily in, right? And like talking about the issue. And they were able to convey how it was such a shared problem that we were going to not be able to continue to decrease the cancer burden in Minnesota if we didn't work together to tackle this problem. And so it's helpful when it comes to those lawmaker experiences. It's helpful when it comes to just building your capacity on the issue and getting other people on your side.
And Britta, I'll just add quick, you might not know, like, I know how to do the hook and the line, but what is the sinker? And I'll just say that you have some of your clinics might have government relations professionals. ACAF is working with folks around public policy. There's organizations like ACS CAN and there's staff in every state for ACS CAN that can help with that ask. And so don't feel like you need to be like, oh, if I don't know the ask, I can't engage or I can't be an advocate, because this work can be tricky and challenging, but know that there's folks in place who are eager to help and support.
Absolutely. Thanks, Emily. So here's an example. Again, this is going to be like if I were in a lawmaker meeting and I had 3 minutes, right, to get everything that I wanted them to know out on the board. And you'll see here in my example here, I'm not going to talk about how many women in Minnesota are diagnosed with cervical cancer this year. I'm not going to talk about all of the different stages of cervical cancer diagnoses and how that can impact somebody's long-term survivorship. Because a lot of those details, those are on a one-pager that all the lobbyists like Emily already give to lawmakers, already talk about. Because those are the facts that a lobbyist can just like shell out on the fly and talk about it. And, it can be the type of thing that like they just need to help highlight the problem really wide to a lawmaker. And that's covered. Other people have had those sorts of things in their pocket, and that's already taken care of for us. But when it comes to individuals sharing their stories and individuals coming forward to talk about an issue, this is the time where you really get to help illustrate a problem, not show the problem. We know it's a problem a lot of times, but we're here really to illustrate that real life impact that a one-pager or a conversation that Emily or other lobbying team can't necessarily recreate. And so again, I'm going to read through this as if I'm in a little lawmaker meeting, just so you can kind of get an idea of how if I was an individual talking to this about my lawmaker, this is how I would talk about it in a way that feels natural and connects to my personal experience, why I care about this work. So I'd say I'm Britta Babel. I live in South Minneapolis and I'm a fierce cancer advocate. I'm talking to you today about funding for the SAGE screening program. This program is essential to screening underinsured and uninsured Minnesotans for breast and cervical cancer. As someone who's lost too many loved ones to cancer, I know how essential it is to make sure that Minnesotans have access to screenings and the care that they need to catch their cancer early when it's the easiest to treat. Can I count on you to support fully funding the SAGE screening program and help save lives? Again, not rocket science, right? I didn't worry about getting mucked up in saying numbers wrong. I didn't get worried about sharing like survival rates of something. I just highlighted why this matters to me as Britta Babel, a South Minneapolis resident and constituent. And this, again, it could look so different who your audience is, who you're talking to when you do this. You might have 5 minutes where you get to have a little bit more back and forth. You might testify for something and be told you have 90 seconds to highlight everything from point A to point B. And again, in those sort of instances and circumstances, you're going to have really great staff like Emily and I really great, right? Who would be able to help support you and make sure you have it all and make sure you have what you need and you feel good and we'll hold your hand even if you'd need to. But it's really just making sure that when we're sharing our stories and we're getting involved, we're just sharing why it matters to us as that individual perspective. Because Emily can't share my experience, why I care about this in the same way that I can share it. So we're gonna challenge you all to just take 5 minutes. So we'll reconvene at 12:46 to just craft your own what your story would be. And so pick an issue you care about. It can be our pretend increasing funding for cervical cancer. It can be a problem that you see at your the clinic you work in, at your organization. It can be around cervical cancer. It doesn't have to be. But just take 5 minutes to draft up what you would say if you had a lawmaker meeting in 15 minutes about the issue that you care about. And again, like Emily was talking about with the sinker might not be perfect, and that's okay. Because a lot of times those are the things that are really, really provided to you when you're talking about an issue. But it's just a good flexing those advocacy muscles. Emily, anything you'd add?
I would just add that none of this is ever perfect, right? I've been lobbying for 4 years and you've heard me. I jumble my words. I might misspeak. But passion and heart is most important, and those lived experiences are most important. And so, using this formula to kind of help you feel confident and ready, and knowing that like you're not going to be perfect, and that is a-okay. And lawmakers don't expect you to be perfect because there's seasoned lobbyists who are not, and that's what makes us different. Like our shared work different is that we show up for people every day. And so for to make the exercise easier for everyone, the ask for today could just be, we want to make sure that individuals with the cervix have access to cervical cancer screenings. And you could leave it at that, just to have something simple to work from that baseline ask. So I don't know if there's like a mechanism for questions, or if folks want to type in the chat as they're crafting their hook, line, and sinker if they have questions. But really look forward to if folks want to share their hook, line, and sinker or have specific questions on this model for Britta and I'm happy to do that. Otherwise, we'll just be quiet for a couple minutes. Maybe the other thing I'll add too is talking a little bit about emotions. I think as a provider, a patient navigator, a patient survivor, caregiver, like these experiences are very personal. It can create all sorts of frustrations, sadness, anger, um, frustration, happiness, right? At times too, because cancer can have good moments. And so I think it's okay to be emotional, right? Britta and I have had several instances when we have volunteers that we work with who testify and they share their experience and they make a lawmaker cry. Britta has made a lawmaker cry when she tells her story about her mom. And that's okay because, like I said earlier, this work is really about connection and it's about how we make each other feel and how we show up and do this work. And I think your passion, your experience, the emotion you can create and send to others forms that connection that's so much more powerful, like Britta was saying, than any fact sheet or statistic.
And we'll come back together in about 1 minute. Don't worry, you're not being graded, so don't worry and rush to finish. But we'll come back in 1 minute. All right. Do we have any? So if you would like to put your hook, line, and sinker in the chat, you're more than welcome to. Or if you would like to raise your hand, our ACAF host will unmute individuals if they'd want to share. But would we have like 1 or 2 people who would want to share their hook, line, and sinker out loud? And it's really okay if not.
I see a couple. So
Okay, I
Jenna
can't see
and
most
Sam,
things on the screen
Yeah.
with the screen share, so go for
I
it.
pulled up the chat. So Gay, why don't you go first?
Can you all hear me out there?
I can. Hello, hello.
Hello, hello. I love this activity. So here we go. And it's not perfect yet. Hello, my name is Galen Richards and I live in South Minneapolis. And I come to you in my past, I'm an oncology nurse, but I really want to talk about my family history. My grandmother, my mother, her 2 aunts, my cousins, and nieces have all been affected either by breast or ovarian cancer. We know now there's a genetic background to this, and I see that there's a bill coming before you to support funding to make genetic testing available to all. And I really want to ask you to support this bill because I don't want to see what I've seen in my own family continue with my grandnieces, my granddaughters, and their descendants. Thank you so much.
Well done. That was fabulous. That was great. That was so well done. Michael, I see you have your hand up. Let's see, I can unmute you. We'll see if that works. Okay, Michael, I think you should be able to chat if you want to try it. We can hear you.
All right, excellent, thank you. So this is my try. Hello, my name is Michael. I'm a social worker at the Roger Maris Cancer Center, and I have worked with so many patients that have had difficulty getting to their treatment appointments. The reason for that is access to transportation, distance to the cancer center, and lack of provider knowledge on cultural issues. It is so sad and frustrating to me that people in our state don't have the ability to access high quality care. This impacts their life expectancy, their relationship with their families, and their community's health. Please consider funding a bill that supports cervical screening among Native American women. That includes funding for transportation, awareness campaigns, and free cancer screenings to those that can afford it. Thank you.
Well done. Michael, Galen, thank you for coming off of mute, for sharing your hook, line, and sinkers. You both are experts. I'm so impressed. I feel like go lobby, go do it. You do your thing. It was fabulous. All right. Anybody else want to come off of mute and share their hook, line, and sinker? All right. So let's move forward into a little bit
Oh,
about
we
a
did have-
Q&A.
Sorry, Emily, we did have one more.
Can you hear me?
Perfect.
Okay, great. So here we go. Hello, my name is Yusef Miller. I'm with Pink Crescent, the breast cancer awareness organization. And I know that there's a bill coming up that is sensitive to the issues of breast health and cancer health. Sorry, I do breast health, cancer health. And my focus is on the accessibility to people of color to research, and we're not being included in research, and we see that they're left out of diagnostics, they're left out of treatment options, and this is critical, and it causes a high rate of death in people of color. I'm hoping that you can be a champion for us. I want to ask you to vote yes with us, to be a champion among these issues and support your constituents of color in this area. Thank you.
Yusef, thank you. I'm sorry I missed you. Thank you, Jenna, for catching that. what I really loved is, will you be a champion? That action-oriented, positive language that creates that buy-in, like you can be a part of the solution, right? Like it's a togetherness thing. So I really loved that language and how you presented it.
Thank you.
Yeah, y'all are pros. Okay, I'm gonna keep us moving forward. So we're at this Q&A session at this moment in time. And I know that we kind of tackled Turquoise Thursday in a different way, right? But what I love about when ACAF approached us about this is like, there's so many ways to be an advocate and to be action oriented. It's, it's taking that pledge around making sure individuals with cervix have access to cervical cancer screenings, but then it's also action around advocacy. And at the state level, the local level, at the federal level, using your voice, your experience for the communities that you serve, showing up and being an advocate for them. And so I'm going to pause. Any questions for Britta and I about the advocacy process, the policy process, about the storyteller process, before we kind of wrap up today's training? All right, I'm going to keep us moving then. So what I did want to say is that there are ACS CAN staff in your state. There's typically a me and a Britta in every state, or somebody who covers that state. And you can find out who that is by going to fightcancer.org. There's a little upper box that says my state. You can go to that state, and if you scroll down, you can see what legislation they're working on, what volunteer engagement opportunities are, and who the staff contacts are, whether it's a grassroots manager like Britta or a government relations director like me. Britta has very also generously offered to help make connections because Britta is a connector and she thrives at it. So also feel free to reach out to us if you want that direct connection. And then I'll just add, the work that ACS CAN is doing and with partners does transcend beyond cervical cancer. We're working on commercial tobacco, youth commercial tobacco prevention, looking at commercial tobacco treatment. We're looking at Medicaid expansion in those states that have not yet expanded Medicaid. We're looking at funding for IHS. We're looking at diversity in clinical trials and patient navigation, and starting to get there on transportation policy as well. So a little foreshadowing for future sessions to come, where we talk a little bit more about the work that ACS CAN is doing in public policy at the state and federal level, the role of health equity and storytellers in our health equity impact, and working with communities and sharing our power with communities, and then how we can all collaborate together. Britta, anything you want to add before we kind of get to that last thank you slide?
No, I think we about covered it with time to spare, which is always a treat when you get Emily and I talking. I'm going to make a very self-serving plug. If you happen to live in Minnesota, in Congressional District 8 in particular, or anywhere across Minnesota, please reach out to me. I would love if you'd be interested in getting involved in our work. I have roles just for you to help make your voice heard and help give you a really strong pathway to empower yourself with your storytelling and making your voice heard. But that's all we've got. So thank you so much to everybody for being here in attendance today, for taking that vulnerability and sharing your stories and practicing that hook, line, and sinker. And thanks so much to our partners at ACAF for inviting us to be a part of this. And we look forward to the ones that we teased out in the future. Jenna, I don't know if anybody from ACAF wants to do anything, like any closing, but I think we're good to go for us.
Awesome. Thank you so much, Emily and Britta. You guys both have so much knowledge, and we truly, on behalf of ACAF, we appreciate your time that you took to spend with us. And I'll just close out by saying happy Turquoise Thursday Day. We're very excited. Just a reminder to check out the ACAF website. We have more events coming up in the future. We have another webinar next Thursday. And also we have our screening pledge live. So just I encourage everyone to get screened, talk to your relatives, talk to your family, encourage that screening. And again, thank you everyone for joining, and thank you Britta and Emily and ACS CAN.
Thanks everyone, be well.
Thanks, Jenna.
Hey, okay, awesome job, guys. Thank you so much.
Thank you. Are we still live on the Facebooks?
We might
or-
be. Hi, Facebook. I don't know, Jenna, you might want to. Says host is live on Facebook still.